How has urodynamic testing evolved through history? Imagine trying to understand how your bladder works just by watching it. That's how urodynamic testing has grown over the years, from simple observations to detailed, high-tech assessments. Early on, doctors mainly watched how urine flowed during voiding. They used basic tools like fluoroscopy, a type of real-time X-ray, to see how the bladder and urinary sphincter behaved. These early studies showed that the bladder muscle, called the detrusor, contracts after the sphincter opens voluntarily, giving a basic understanding of bladder function. As technology advanced, especially in the mid-1900s, cinefluoroscopy came into play. This method allowed doctors to record continuous moving images of the bladder during filling and emptying. Researchers like Earl R. Miller and his team at the University of California, San Francisco, helped popularize this technique. By the 1970s, combining cinefluoroscopy with other tests like cystometry, which measures bladder pressure, and uroflowmetry, which records urine flow rate, became common. These combined tests helped doctors better understand complex urinary problems like stress incontinence and bladder outlet obstruction. The next big step was standardization. During the 1970s and 1980s, experts developed guidelines for how to perform urodynamic tests and what equipment to use. The International Continence Society, a global organization, played a key role in creating these standards. This made testing more reliable and comparable across different clinics and studies. It also helped researchers share data and improve understanding of bladder disorders. Today, urodynamic testing is more sophisticated than ever. It includes a variety of techniques such as detailed measurements of urine flow, pressure recordings of the bladder and urethra, and assessments of how well the pelvic floor muscles work. These tests are vital for diagnosing and managing lower urinary tract issues, especially in patients with bladder problems or bladder cancer. They help doctors decide on the best treatment plans, whether that's surgery or other therapies. In the context of bladder health and bladder cancer, urodynamic testing is incredibly useful. It helps distinguish different types of voiding problems, guides surgical planning, and monitors how the bladder functions over time. For patients with bladder cancer, it can track changes in bladder capacity and function, helping to manage symptoms and adjust treatments as needed. The evolution of these tests reflects ongoing technological progress, making diagnosis more accurate and patient care more personalized. Always remember, if you have concerns about bladder health, consulting a healthcare professional is the best step. The journey from simple observation to advanced diagnostics shows how much progress has been made to help people maintain healthy bladders and manage bladder conditions effectively.